is Andrea Byrnes, and I'm the owner and the Alzheimer's Consultant for Care on Call. Working with individuals with dementia is a passion of mine. After my father had a stroke and his Alzheimer's disease progressed, I went home to take care of him for 3 years. Never having done this type of work before, I sought out employment from a company that specialized in elder care, and that's when my mission to help my father began. I researched different ways to support him and sought out advice from caregivers and several different associations. However, the advice that I got was what I thought was always common sense. After my father, Francis Byrnes, passed away, Care on Call was built. It is my calling to give families quality care with compassion. As an Alzheimer's consultant, I work with the family and am also available to work with the person suffering from dementia. I teach the family what I like to call tricks and tips. These save time and saved my sanity. Driving, for instance, is an issue that will eventually come up, and you might find that your loved one is not so willing to give away the keys so easily. A tip that aids an issue of driving is to simply get in the habit of you yourself being behind the wheel early on. This gets the person with dementia used to sitting in the passenger seat and prepares them for the adjustment of when they can no longer drive at all. For the later stages of dementia, a trick that I use is to put a post-it note on the dashboard where the person with dementia is sitting in the passenger seat, stating where they are going. This may eliminate the repetitive questions. My dad used to ask me, "Why aren't you telling me where we're going?" when I had answered his questions 20 times in the last 2 minutes. I learned by putting a post-it note, for instance, saying that we're going to McDonald's, eliminated much of his frustration and allowed me to maintain a sense of humor, remembering my dad as the lighthearted person he used to be. Keeping in mind that this is a disease that drastically affects one's personality. So my job is to help you deal with this debilitating disease of dementia and to make your life easier and to help the person suffering with dementia's life happier. I do this by promoting communication. I do something which is to teach you how to speak Alzheimer's. Learning the language of Alzheimer's allows you to ask questions in a certain way without making the person with dementia feel stupid. Learning this language also allows you to have the appropriate responses. For instance, in the later stages of dementia, when your loved one tells you that they need to get dressed and they need to go to a meeting for work, you can respond, "Honey, someone just called and your meeting was canceled." During my visits, I like to provide these type of ideas as well as worksheets, videos, and other resources and information. I offer what I like to call is Cliff Notes to Surviving Alzheimer's. This is where I've prepared the information from several books and resources and information that I think is the most practical and offers the best solutions. What an Alzheimer's consultation looks like is it can last anywhere from several hours to several days, as you are always in control. If you would like the individual with dementia to be involved, this usually requires more role-playing and modeling, which usually requires more time. First, I like to do an assessment where you and I dialogue, and my main goal is to find out what your goals are. I also like to view the interaction between you and the person with dementia, as it helps me to get a feel for their personality and their cognitive ability. Please keep in mind, however, I have no medical training and I cannot diagnose or give any advice. After this visit, you can choose to have me come back, and this will be a follow-up visit where we discuss the plan to meet your needs. If you are not the full-time caregiver and your loved one is residing in a facility, this part of the process looks a little different, but it is still extremely important. We then share the plan with the other caregivers at the facility, as being an advocate for your loved one is vital. I use some forms and some documentations that I ask the other caregivers at this facility to fill out, and we can also set up a meeting where we can dialogue with the facility some of your outlined expectations. Then the plan is put into action. This gives you time to practice any of the ideas or techniques that we might have discussed. Some of them will work, some of them won't work. You can have me come back as many times as you choose. I'm not here to put pressure on you. I'm here to alleviate your stress and respect any choices that you may make. I believe that you ultimately know what's best for your loved one just because of the simple, undeniable fact that you know them best. At the end of the consultation, I usually discuss some of the issues that might arise in the future and appropriate ways that you can meet those challenges. I may also discuss ways that friends and family can help you in appropriate ways. I wish you the best of luck in your journey with Alzheimer's.
Care on call with compassion for all. Just a phone call.